I am a voice therapist. So I work with patients with voice disorders across the board, but I have a unique insight into spasmodic dysphonia and neurological voice conditions, as again, I do have spasmodic dysphonia myself. So, I know right now is an extremely difficult and challenging time for many people for a number of reasons, but having a chronic voice condition can make that all the more challenging. So, I know that many individuals have had Botox injections that have been rescheduled or canceled to where they might not know the date that they're going to be rescheduled. That can cause many individuals to have much more severe symptoms if they are relying on their Botox injections to kind of manage their symptoms. I know that everybody in general right now is dealing with a lot more anxiety and stress in general, and that can certainly, as many of you probably recognize, can lead to increased voice symptoms, and it can lead to more tension or strain when you're trying to speak. And, I know a lot of you are also talking on the Facebook page too about increased demands on the phone, increased demands virtually, so Zoom meetings, phone calls, even to stay in touch with people and to connect with people. It's all virtual right now, or it's all phone calls right now. And for somebody with spasmodic dysphonia or somebody with a, neurological voice condition or, a chronic voice condition, those can all make symptoms a lot worse. So I'm going to run through some voice therapy techniques today. So, I do want to start with a few caveats. I will say that, voice therapy generally, it's recommended that you do it with a speech language pathologist and voice therapist. And that's important to note because you want to make sure that you're doing strategies in the correct way. You want to make sure that you're doing strategies that are really going to be helpful for your specific symptoms and your specific needs. So I'm going to give a very general overview of voice therapy techniques that could be helpful. But again, it's very general, and each person should really find a speech pathologist to work with on these techniques if they're wanting to get more into voice therapy. So the other, and I will say that right now that does look like teletherapy. So, if you're looking to work with a voice therapist, it's going to be teletherapy at this point. So the NSDA has a great listing on their website for providers that do teletherapy and speech language pathologists that are doing teletherapy right now. If you're looking to receive those services, I think that's a great place to start. You do want to make sure that the provider is licensed in the state that you're currently in, as well as their state. So, I'm licensed in Massachusetts, but also in several other states. So I would be able to see patients in the states that I'm licensed in, but not any other state. So you want to make sure that the provider should be knowledgeable about those restrictions, and some of them are loosening their, some states are loosening their regulations, but you do want to make sure and keep that in mind if you're looking for a provider. So, the last caveat here is that if you have spasmodic dysphonia or you have vocal tremor, these techniques are really not meant to cure the spasmodic dysphonia or the tremor. The techniques can resolve something like muscle tension dysphonia if it's not secondary to something else like spasmodic dysphonia. So these techniques are really designed to be compensatory, which means they'll give you a lot of helpful tools and strategies to be able to really control your voice and to be able to maybe not have a perfect voice quality. You're still going to have the underlying symptoms of tremor or spasmodic dysphonia, but hopefully these techniques can give you some tools to better manage those. So I encourage you to try these techniques along with me. I'll kind of walk you through what you should be feeling and maybe what to look out for to avoid feeling while you're doing these. So I can't see any of you, I can't hear any of you, and nobody can hear you or see you. So if you want to practice these voice techniques, go ahead. I fully encourage you to practice them along with me. So we're going to start with some resonant voice techniques. These techniques are really meant to re-coordinate how you're using your voice. So all these techniques I'm showing you today are really to re-coordinate how you're using your voice to hopefully get you to be using your voice in a more efficient way. So again, they're not curative. You're still going to have the underlying symptoms if you have a neurological voice disorder, but hopefully it can give you some relief of the strain maybe that you're feeling, or the tension or vocal fatigue that you might be feeling. It can hopefully give you some techniques to, be able to speak on the phone more easily, or to be able to communicate via Zoom meetings, or to be able to better manage your voice. So I'll start with resonant voice techniques. So the idea here is to get a really forward focus of your voice. So, I can use a voice that's really focused in my throat. And, if I'm, saying a sentence and drop it down into my throat, you hear that's a very rough voice. I feel that a lot in my throat, and I can feel roughness. I feel vibration here, and I feel tension in my throat. I can shift my voice more forward, which is what I'm trying to do a little bit more of now, and shifting it to where I'm feeling vibration more forward at my lips, in my nose, in this kind of mask area, rather than kind of letting my voice sink down to just be in my throat. So we'll start with what's called a resonant hum. This is a basic resonant technique. So you can try this along with me. You want to really do this in a normal volume and a normal pitch for yourself. So don't try to go way up in pitch. Try to do it at a normal volume, normal pitch. So you're trying to get, so I will say also Zoom may try to modify the sound a little bit. It may dampen the sound a little bit after a few seconds, but you should feel a strong vibration. You should feel a consistent vibration, a consistent pitch and consistent loudness throughout this whole thing. Okay, so I'm feeling a lot of vibration here. If you have tremor, you're still going to hear a little bit of that tremor. You want to not try to fight against that. If you have tremor, let the tremor happen. If you're trying to fight against that, you're going to likely be using a lot more strain and tension, and that's what we're trying to avoid. So try to get a really easy production, something that just feels really effortless. You don't want to be feeling anything really at all in your throat here. So if I'm doing hum and it's something like this, or right? I'm feeling a lot in my throat there, and that's really what we're trying to avoid. So doing a hum where you feel more forward focus is really what you want. So, okay, so trying to get a lot of vibration forward. I feel a lot in my lips there. If you're having difficulty feeling that at your lips, you might still be focused a little bit in your throat with that sound. So you want to try to think about the vibrations growing here at your lips. So try to focus and get your voice to be shifted forward a little bit. So again, really strong vibration with no effort here. You're not pushing to try to make that sound. If I'm squeezing my muscles in my throat to make that sound, it would sound very strained, right? That's not what we want. We want an easy production where these muscles are pretty relaxed. And you try to feel a lot of that strong buzz in the front, okay? So if that's still difficult, you can try to do a sigh hum. Okay, so again, you're trying to get all the vibration to be really focused forward when you're doing that. So that can help you. The sigh hum can help to release some of your airflow. Make sure you're not holding your breath when you're doing this. So some of you might try to compensate for some of your spasmodic dysphonia symptoms or vocal tremor, for instance, by squeezing these muscles in your throat, and you might try to compensate like this, right? So this resonant voice technique is trying to get rid of all that strain and trying to give you an easier production, a more efficient voice production here. So you want to make sure that you're not holding anything, you're not squeezing your throat, you're trying to really release all that. Okay. If the hum is not feeling great, you can try to do this with other resonant voice sounds. So you can try maybe using an N sound. So hold out that N. You're going to feel this more at the roof of your mouth, maybe at the tip of your tongue when you do this, than directly at your lips. Okay, so you might feel some in your nose, you might feel some at the roof of your mouth. Again, the object is to feel that strong vibration coming forward. So you can try a V sound, which is really, you're going to feel that at the tip of your lips. So again, sustained sound. Feel that strongly at my lips. Nothing in my throat. So if you are pushing, right, you're going to feel a lot of strain in your throat, and that's what we're trying to get away from. Again, this should feel really fluid and easy. Your breath flow should feel pretty released with this. So you can try the hum, or a regular hum, or you can try an N sound, or a V. Okay, so again, I'm feeling a lot of feedback here, and I'm not feeling anything in my throat here. If you're feeling like it starts here and then goes down to your throat, you want to make sure that you're maintaining consistent vibration and airflow. So if it starts off here and then it goes rough, it'll sound like this. Right? Then I start to get some of that, those breaks, that tension in my throat. You want to try to keep it consistent. Okay. Once those are feeling good, you can try to bring that into a resonant voice chant. So you can try to chant that with some resonant voice syllables. So you can do something like me, me, me. Okay, so you're trying to feel that vibration consistently at your lips here. Me, me, me. Okay, you can try that with a mo, mo, mo. Again, the object here is not to get a perfect voice quality. So if you have an underlying voice condition, especially if it's neurological, like tremor or spasmodic dysphonia, you'll likely still hear some of those symptoms, but you're just trying to smooth out that voice a little bit. And again, you should not be feeling anything in your throat when you do this. You can try to do a chant with some of the other sounds that you've worked on. So maybe the N sound. So you can do no, no, no. Okay, again, I'm keeping that resonance throughout the whole thing. I'm not feeling the squeeze. No, 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 right? It's not squeezed in my throat. I feel that a lot. You can hear that strain in my voice. We're keeping it here, keeping it easy and released. You can try using some increased intonation with that. So you can do something like me, 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 okay? Me, me, me. So again, that's not sounding much like natural speech, but you're exaggerating that intonation pattern a little bit to get it out of your throat, to try to increase your airflow a little bit and to get a more efficient pattern. You can try to bring that into sentences. So if I do a sentence with a lot of those resonant sounds, like maybe a sentence with a lot of those M's or a lot of those N's, we can choose a sentence like meet me at noon. So I'll do meet me at noon. So I'm trying to keep my voice really focused here rather than using so much strain and effort in my throat. So if you're compensating for spasmodic dysphonia or tremor, or you have MTD, you might be tempted to engage these muscles and it might sound like meet me at noon, right? That's a lot of strain in my throat. If I'm shifting my voice forward and trying to let my breath flow forward with that and feel that consistent forward vibration, I can get a smoother voice quality. So again, meet me at noon. Okay, so I'm trying to get that really, really forward focus. Again, you can play around with using some of that kind of bouncier voice quality, so a little bit more of that intonation when you're speaking. So meet me at noon. You can try this with other sentences. So you can try this with something like nice to meet you. So nice to meet you. You're trying to get that forward focus. You can try it chanted first again. Nice to meet you. I'm trying to get that forward focus of the vibration. You can make sure that you want to make sure that it feels really easy. Okay, so this should not feel like work. It's not designed to work your vocal folds. It's not designed to work your muscles in any way. These are not strengthening exercises. That's not the goal. The goal is to just get a little bit more of an efficient voice quality. So that's one technique that you can use resonant voice techniques as kind of a voice warm-up. So, you know, for instance, I might use some resonant voice techniques to warm up my voice in the morning. So I'll do some hums, some maybe resonant voice sounds, maybe some sentences, and you can really feel your voice be more focused here rather than be so much rather than being focused in your throat. You can use the resonant voice strategies as kind of like reset techniques. So for instance, if you're having a lot of Zoom meetings, or if you're having a lot of phone calls, or even if you're talking a lot throughout the day, you can use these resonant voice strategies to reset. So do a few hums in between your Zoom meetings, or do a few hums, you know, before you get on the phone with somebody, so that you feel like you're a little bit more in control of your voice. You have a little bit more expectation about what's going to come out when you open your mouth, right? You know, that's something for spasmodic dysphonia, where sometimes you don't necessarily know what sound is going to come out. It could be unpredictable. And so these strategies can give you a little bit more control over those voice symptoms. Again, you're not trying to fight through breaks here. You're trying to ease maybe through the breaks with a different focus of your voice, increased efficient breath use, and a more efficient pattern of voicing. So the goal is also to start to use these strategies for when you're speaking conversationally. So instead of kind of like speaking with a lot of effort here in my throat, right? So you might be tempted to compensate in that way in your throat. I'm going to try to use these resonant voice strategies when I'm speaking to have less of that throat impact, less of that strain and that muscle tension. So that does take some practice to start to feel what that feels like. It does take practice of doing some of these resonant hums, these resonant sentences, and using these strategies, you know, in conversation. It does take practice and repetition of this to really be able to start to use these strategies in conversation. But you can, that's the end goal, to be able to implement them in any conversation that you're having, whether it's a phone call, whether it's an in-person conversation, whether you have a more challenging voice day or a voice or a day with worse voice symptoms, you might be able to rely on these voice strategies a little bit more. So, you know, you can rely on them more so too when you're having a harder voice day, or when you're having increased voice challenges like right now. So I'm relying on voice strategies more so than I would, for instance, when I'm, you know, at my optimal Botox injection cycle. So it's okay to do them throughout the day. It is also going to be beneficial. So you can do them as often as you'd like to, as long as they're being done in the correct way and that they're feeling easy. And again, the best way to know that is by working with a speech language pathologist and voice therapist directly while doing this, to make sure that you're doing it correctly and working towards your goals and specific needs. But you can try out these voice strategies. I know right now is a very challenging time where not everybody has access to care. So as long as they're feeling easy and they're feeling good, you can start to explore some of these techniques and how they can be helpful. I will show you another technique. And again, I'm going through these very quickly. This is a very, very brief overview of some techniques, but they're just a brief window into how voice therapy can be really beneficial for managing and coping with some worsening symptoms. So I'm going to show you something called straw phonation. So it is called a occluded vocal tract technique. So basically, it's a really ideal and optimal configuration of your vocal tract that gives you an optimal voice efficiency. So it gives you optimal voice outputs, so a clear, efficient, smooth voice with very little effort in your throat. So one strategy for this is straw phonation. So I know most of you probably don't have straws just lying around. If you do have a straw somewhere, wherever you are, and you want to try this, you can try this along with me. So basically, we're going to take the straw and put it in your, between your lips, to put it in your mouth, and your lips should close around the straw. So you're not going to use any tension here. You're just going to place it gently in between your lips and try to get the same feeling as when you're doing the hum. So it's going to feel a little bit different here, but you should feel the same amount of vibration. You should feel the same amount of resonant feedback here when you're doing this. So you can, again, try this with the straw in between your lips. Okay, so I'm feeling a lot of feedback here. I'm not feeling effort in my throat here. The sound is moving through the straw when I have that strong vibration here. I'm not pushing anything through the straw. I'm not working harder to get the sound through the straw. If I have a strong sense of vibration here, it will go through the straw without me having to push, okay? This is designed to make it a little bit easier to voice, to get sound without using so much effort in your throat. So again, you can try that hum with the straw in your mouth. Should almost feel like you're like playing a kazoo. A kazoo is also really helpful for something. You can use a kazoo kind of in a similar fashion if you do have a kazoo. It's getting at the same aspect where you're using your airflow efficiently. Your vocal tract is in a really efficient configuration, and it should be really easy to do, okay? So this is a great reset technique too. It's great to train a more efficient voice production pattern. So if you're having trouble getting any sound here, think about what we talked about with the hum, maybe releasing some more of your airflow or checking to make sure you're not squeezing these muscles here or holding your breath. So you can try the sigh hum through here too. Okay, a good check is to see if there's airflow coming out on the other end of the straw. So I feel consistent airflow coming through. Again, I'm not pushing that airflow out, but because I have that strong, consistent vibration, I feel that airflow coming on the other side. You can try this in water too. This is one of my favorite techniques. Again, this might not work for everybody, and this might take a little practice to coordinate for you, but you can try this in a glass of water too. So I will warn you, don't use a full glass of water because this will get everywhere. So just a glass of water filled partly or halfway through, halfway up. You're going to take the straw and do the same exact thing that you just did, now just with the straw a little bit under the water. So you can start with it just about an inch under the water. Okay, so you see that I have some bubbles forming here. They're consistent, they're even. I'm feeling that consistent and even feedback on my lips with that. So again, it's getting that really even, easy voice where you're not pushing any of that. Don't work harder just because you have water here. Try to just keep it about an inch to start under the water. You know, this can be really helpful in releasing some excess tension and again, creating a more efficient voice production pattern for you. I use it as a reset technique too. So if I'm having a lot of phone calls and I have a quick minute in between patients that I'm seeing or in between phone calls, I'll just do a little bit of, for me, that feels really good, and it gets my voice back to a place that feels much more efficient and more forward and easier. You might notice that after you do that for a few minutes, that maybe your voice is a little bit more released. Maybe it feels a little bit easier to speak after that. So that's the goal, that you also kind of carry this feeling into how you're speaking. So how you're conversing after this. you should be able to maybe feel a little bit of a release of the strain, or feel that that gives you a little bit more of this forward focus that we're going for. So again, you can do this as often as you'd like. You can do this, about 10 minutes per day, or as a warm up in the morning, or as resets, as long as you know that you're doing it correctly, without effort in your throat, without that push, without that strain. Okay, so I know we're running short on time, and again, I went through these really quickly. There is a handout that goes along with this that goes over teletherapy, and then there's a separate one that kind of goes over the techniques that I talked about today. Again, remember that these are not meant to get you to a perfect voice quality. They are meant to give you tools to cope. My voice quality is not perfect, and anybody with SD or tremor, you're going to still have those symptoms, but you can hopefully manage them a little bit more efficiently with these strategies. So I'll go quickly through some helpful tips. I'll go into this in a little bit more detail in the following webinar, but for phones and virtual visits, headphones are going to be a really great tool. So I have an iPhone, so I use Apple headphones, and these actually have a built-in microphone right here. So if you have the headphone in, you can actually speak directly right into the microphone here, which is really helpful. And it's much more helpful than trying to speak on the phone where your voice is not directed exactly into the microphone. That's a helpful tool. If you put your phone on speaker, that can also be helpful. So putting it on speakerphone and then holding the phone right in front of you can be much more helpful than if you're holding the phone up to your ear again and trying to speak that way. Use all these techniques that we talked about before a phone call, before a virtual call. Warm up your voice and maybe practice your hello, right, in this forward focus. Maybe practice what you're going to say on the phone call in your resonant voice, and that could be really helpful too. You can also try to speak more forward. Most people tend to project more by using effort in their throat, especially on the phone. You think that people aren't going to be able to hear you as well, and sometimes you do need to project a little bit more. Try not to do that from more effort in your throat like that. Try to do that by actually releasing these muscles and using those techniques that we talked about today and making those sounds a little bit more resonant, and shifting your focus a little bit more forward, getting those sounds to be a little bit crisper or clearer at your lips. And so I also use a technique sometimes of having one headphone in. This is what I use for computer webinars. It can sometimes be helpful for modulating your volume. So if I were to have two headphones in right now, it's a lot harder for me to gauge my volume, versus if I only leave one in, I can kind of get some more feedback as to what volume I'm speaking at and how my voice is functioning. So that's an added trick that you can play around with. Again, warm up your voice or use these techniques even right before a phone call. So do some resonant voice work, do some straw phonation, and you'll feel like you have some more control right before you go into the conversation or the phone call. So I'm gonna go through some techniques that hopefully will be helpful in terms of dealing with some symptoms, in terms of compensating for what voice symptoms that you might be experiencing right now. So, I know that right now is a very, very difficult time for many people in many ways, but to have a voice disorder, chronic voice disorder on top of that, and then the added layer of maybe having difficulty getting treatment right now, that can lead to some exacerbation of your voice symptoms. So hopefully some of the techniques I showed today, as well as maybe some of the ones that I showed last week, can help you kind of get through or cope with whatever you're dealing with right now. So like we mentioned, these webinars will be recorded, so you can go back to the first one if you want to see what I talked about in the first one, or you can go back to this one afterwards and view it. There's also handouts that will be posted too, so check out the handouts for some more information or more kind of detailed instructions too, to go back and to maybe have with you when you're practicing. Some of the handouts are more detailed, and then one is kind of just quick tips that I'll go through today, along with it has some a link to some blog posts as well that have some more information, some more educational materials, or just coping strategies for dealing with voice disorders at this time if you're interested. You can also feel free to email me. So the email's on that handout as well. I can put it in the chat box. So if you have any questions, please feel free to either write in the chat box here or feel free to email me afterwards. So I'll say the kind of caveats before I jump in that I said last time. So these strategies are not meant to cure any neurological voice disorder. So, you know, I have spasmodic dysphonia. I still have my spasmodic dysphonia, but I'm able to use voice therapy strategies to help compensate and to help kind of manage and cope with my symptoms a little bit more. So it's not meant to take away your symptoms completely or to get a perfect voice or to cure any voice disorder like spasmodic dysphonia or tremor, but hopefully it'll give you some strategies to be able to manage them a little bit better or more efficiently. The second thing I'll just say quickly is please make sure to be working with a speech language pathologist if you do engage in any of these voice therapy strategies. We want to make sure that you're doing the strategies correctly, that you're feeling what you want to be feeling when you're doing these strategies, and that you're really able to individualize them to fit your specific needs. So with those disclaimers, I'll kind of jump into today. I'm going to talk about mostly airflow and how to more efficiently use your airflow when you're speaking. So, you know, when we speak, our airflow is extremely, extremely important. So if I'm speaking and I'm not using much airflow, I might feel some strain. I might feel some effort in my throat. I might feel some inconsistent voice or more severe breaks. If I'm able to even out my airflow and use my airflow a little bit more efficiently, I might be able to better compensate for some of those symptoms. So I'll show you what I mean. So I can speak with, you know, very little airflow, which would kind of be in my throat here, where I'm kind of pushing my voice, or I'm just kind of like letting my voice sink down here, where it's rough. Both of those don't sound very clear. They sound strained or rough. They are very uncomfortable in my throat. So I can speak with very little airflow, or I can try to speak with a little bit more airflow like I'm doing now, where I'm trying to compensate for whatever symptoms I might be feeling in my voice by using my airflow a little bit more efficiently. So when we have any sort of voice disorder, especially something like spasmodic dysphonia or vocal tremor or MTD, that can definitely interrupt our efficient breath use patterns for speech. So it can make us feel like we're using more effort during speech, that we're pushing our voice out a little more, that we're running out of breath when we speak or getting short of breath when we speak. And so using this airflow can be a really efficient way to manage those symptoms and to get your voice to be a little more consistent and even and to gain some more control. So what I'll show you is some flow phonation. So you guys can try this along with me. I can't see you. Nobody can see you or hear you. So I encourage you to try these strategies and see what might be helpful for you. So if you want to do this along with me, you can do this with your hand. You can also, you may have seen this done before, or you can also do this with a tissue held in front of your face. Right now, I'm just going to do it with my hand, so it's easy for you guys to do along with me. So you can start with just getting some easy airflow. So I'm going to start with just air, so just breath and no voice at all. So I'm going to purse my lips and see if I can pretend I'm blowing out some birthday candles and really just feel a consistent, easy breath on my hand. Okay, so my lips are pursed. You can't hear me doing this. It's supposed to be silent. It's supposed to be passive, but I feel a lot of consistent airflow on my hand when I do this. Okay, even if you have tremor, even if you have SD or MTD, you're not engaging these muscles here. Your throat muscles are relaxed when you're doing this. It's supposed to be really smooth, really easy. You're feeling a lot of consistent, even breath on your hand. Now, if it's feeling really choppy, or if it's feeling not so consistent, you might be breath holding at certain points, or you might be holding tension maybe in your throat or maybe somewhere in your chest, or maybe even lower in your abdomen. So make sure you're not holding tension anywhere, and try to just have this be really consistent and really even and fluid. Okay, now once that's feeling pretty even, we're going to add some voice, because that's obviously the goal, to use the same sort of breath when we're speaking. So I'm going to have you do a whoo sound. So it's going to be a really breathy, easy sound, ideally. So you're going to start with a little bit of breath flow and then ease into some voice there. So So it's a breathy sound. You hear that breath in my voice. I also feel some forward vibration, because I feel that sounds coming and vibrating my lips, but I feel that consistent airflow on my hand. Okay, so you should feel the same amount of airflow and a really consistent airflow as you did when you were just doing air. So if you felt like when you were just doing the airflow, you had consistent air, and then when you went to add in voice, it completely dropped and you don't feel that same amount of airflow, you're probably holding your breath or not using your breath as efficiently as you can be. So again, check to make sure that you're not engaging your throat when you go into this. So if I'm doing something like, whoo, I'm clearly pushing a lot there. You can hear that strain. I can really feel that. If you're kind of using a lot of your air at once, you're going to run out of air pretty quickly, and it's not going to be really even and consistent. You can also avoid taking a huge breath before you do this. So if you take a huge breath, and then you try to do that, you can tell that's way too much breath to be using, and I'm actually holding some tension in my throat when I do that. So try to release any tension, any of your throat muscles that are being held here, and see if you can get that easy, consistent sound. So I'm using about maybe 70% airflow and about 30% voice. So I'm not trying to make a super loud sound here or a very pushed or strained sound. It's really something that's supposed to be pretty easy and fluid for you. And we're going for this kind of increased breathiness, this kind of exaggerated breathiness that I'm demonstrating right now, not natural speech. We'll get there. Just feel that increased breathiness and how that can maybe decrease some of the effort or push that you might feel in your throat. So once that is feeling pretty good, just doing the who, we're going to try to bring it into some sentences. So you can try the sentence, who are you, with some of that breathiness. So again, keep your hand in front of your face so you can feel for that consistent, even breath flow. So, who are you? Okay, so it's a consistent, even tone. My breath feels really consistent. My voice feels pretty smooth and consistent there. I'm not doing who are you, right? Or who are you? That's holding my breath or using some tension in my throat to make that sound. Instead, I'm trying to release these muscles again and try to get a little more of that consistent, easy airflow. Who are you? Okay, now obviously this doesn't sound like real speech right now. We're going to make it sound a little bit more natural, but you can play around with how using that consistent, even breath flow can maybe make your voice feel a little bit more released or a little bit easier. If you're having trouble, again, feeling that consistent airflow, check for any tension. Make sure you're not holding your breath when you're trying to do this or working too hard to push the breath out. So if you're holding your breath, it'll sound kind of like, who are you, right? You might even try to do that while holding your breath to get a strong contrast. So try one where you're purposely holding your breath and you can hopefully feel a difference of that version versus when you're actually releasing and using that breath. So instead of having that squeeze where I'm breath holding, what if I try to actually release that on my exhale? Who are you? We're going to try to make it a little bit more natural, a little bit more towards speech. So you can try to add in some increase in intonation. So, who are you? Who are you, right? I'm still maintaining that breathiness, but now I'm adding a little bit more speech characteristics, a little bit more intonation to make it sound a little bit more natural there. You can try some other sentences here. So sentences with H's or WH's might be really helpful. So I know some of you might have difficulty with H's. If you have ABSD, see if you can still get your voice to be, or your breath to be really consistent with this voice here. So let's try a different sentence. How are you? How are you, right? It's still this kind of breathy voice. I'm not pushing, how are you? I'm not letting it drop, how are you, in my throat, but I'm allowing that airflow to be just easy and consistent. I may be thinking about what it felt like when I was just flowing airflow without any voice and trying to mimic that same feeling where you're getting that really even, consistent airflow throughout the whole thing. Now, if you feel like that you do the first sound and then you just immediately run out of breath after that, so if you're doing, who are you, right, and then it gets really strained, you're not keeping your airflow consistent and you're losing a little bit of that airflow because you're pushing so much with that first sound. So if I use all my air in that first sound, who are you, right? I'm out of air by the time I get to the end of the sentence. So see if you can regulate that breath a little bit more by having it be a little bit easy and not pushing so hard on that first sound, but easing into that a little more. So, who are you? You can try some other sentences. So, who won the game? You can do who is Sue, right? All of this, you hear that kind of smooth, consistent airflow. Now, if you have tremor, if you have MTD, if you have SD, you might still hear some of those symptoms when you're doing this. The goal, again, is not to get a perfect voice quality. The goal is to get a smoother voice quality. So if you can get it to be a little bit more smooth, or if you can get a little bit more control over that, that's the goal. And that's what that breath flow and speaking with that breath flow will hopefully give you, is a little bit more control and ease. So, you know, this airflow can be really, really convenient to decreasing tension in your throat or decreasing any sort of effort or strain. So the goal is to bring this into how you're speaking day to day. So how do you start to implement this maybe efficient airflow, or maybe using your breath while you're speaking so that you're not speaking so much from your throat. So again, I can compensate for breaks by kind of speaking like this, where I'm pushing my voice out. Or I can kind of like let my voice hang down here where I'm really not using airflow for either of those. Or I can let my voice be really much smoother when I try to change the way that I'm using my voice a little bit. Again, I'm still using that forward focus that I talked about last time, where you're trying to feel your voice being really focused up front. You don't want it kind of sitting down low in your throat here. You really want to still be speaking from here, from your lips and your tongue in a forward manner, but also now maybe implementing some use of that even consistent airflow. That can help too. So I'll talk about how this airflow can also be helpful for specific, for sound specific challenges. So for instance, if you have AB or AD, you might notice that you get sound specific breaks. So you might have breaks that are specific to or more challenging after certain sounds. So for AD, for adductor spasmodic dysphonia, you might notice that sounds, so vowels after voiced sounds are likely going to be more difficult for you. So you'll experience kind of this strained, strangled breaks where your vocal folds are coming together and they're kind of squeezing and spasming when they adduct or when they come together. And so you might notice that vowels after what's called voiced sounds might have that strong, squeezed, strained break after it. And so voiced sounds are consonants or sounds in the English language that have voice. So there's voiced and voiceless sounds. So voiced sounds would be da, ga, the z, all of those have voice to them. They have sound when I'm producing them. Versus voiceless sounds, that would be something like sh, right? All of those are just different modulations of my airflow, but they don't have any voice to them. So if you have AD, the adductor type of spasmodic dysphonia, you're likely going to have a lot more difficulty with vowels that follow these voiced sounds, because that's when your vocal folds are coming together to make voice and they're spasming when they're coming together, leading to kind of that strained, strangled voice break. So I'll talk about AB too in a second, but if you have AD, you can maybe use some of this airflow that I just talked about to smooth through some of those breaks. So, you know, if for instance, you know that D is a particularly hard sound for you and you know that you're gonna break on the vowel right after that, maybe try to use some airflow to make that a little more even. So instead of something like dog, right? Dog, where I know I'm gonna kind of break on that and I feel it in my throat, maybe try to see if you can use some airflow to smooth that out. So dog, dog, right? I'm using a different form of airflow versus squeezing my throat to fight against the break. I'm releasing my muscles and trying to use some of that airflow to flow through that instead of fighting against everything that's going to just exacerbate my symptoms. So for AD, you might also notice that words that start with a vowel are often pretty difficult. So you might notice that they're called vowel onsets. So you might notice that, for instance, the word eat or apple might be really difficult because you're automatically starting from voiced. You're starting with your vocal folds coming together, and you might even be starting the word with a spasm there. So you want to see if you can use what's called an easy onset. So maybe ease into that word rather than starting from such a squeeze or strained place. So I can say the word eat, right? Eat, where I'm really, you can hear that strain in my voice when I'm starting the word. Or I can think about using some of this flow and ease into the word. So eat, eat, right? So I'm flowing into that word by using my airflow a little bit differently. So you can practice this. An interesting way to practice this is by imagining there being an H in front of that vowel onset word. So you can start off practicing with an H in front of it, and then we're going to gradually take that away. So if you do eat, eat, and then gradually take away that H and make it, still keep some of that airflow, but make it a little more natural. So eat, right? So I'm still easing into my word with some breath, but I'm not starting from a place where I'm just squeezing my muscles to start that word. So then if you have, some of you might be familiar with the sentence, we eat eggs every Easter, right? That's a really tough one for anybody with AD. And, you know, that's a tough one even for me because it has all those vowel onset words. But what you can do is you can use that breath flow through that whole sentence. Use those easy onsets to help smooth that out. So we eat eggs every Easter, right? That's a little bit more smooth than if I were to do we eat eggs every Easter. Or if I were to break up my breath and do we eat eggs every Easter. If I'm breaking up my breath, it's going to be a lot harder to feel that flow and to feel that ease. If I'm allowing my breath to carry through that whole sentence, it's going to be a lot easier for me to get the whole sentence out. And likely I'll have maybe less severe breaks or less severe tension in my throat. So you can use that to kind of almost have it help you carry the voice a little bit more. So for AB, you likely already feel a lot of breathiness in your voice. So you're kind of more breathy maybe, and you have breathy breaks rather than the squeeze breaks that you have with AD. So for AB, for abductor, it's the vocal folds are spasming when they're coming apart and when they're transitioning from voiceless sounds into a vowel. And so again, those voiceless sounds are going to be the sounds that are silent with just air. So p, t, sh, h. So those might be more difficult sounds for you, and you might experience like hello, that kind of prolonged breathy break after that voiceless sound. So same thing that I was just talking about with AD, just in a slightly different modified way. You're going to still want to keep your airflow pretty consistent. So you're losing a lot of air when you have those breathy breaks. But if you can keep your airflow a little bit more modulated and more consistent, it can help you maybe to control those breaks a little bit more or ease through the breaks so that you're not running out of so much airflow there. So you can try that. So a sentence like Harry hit the hammer is probably going to be pretty hard for anybody with AB because it's all voiceless sounds with the H's starting those. So use that airflow. So Harry hit the hammer. Again, you're still going to have those breaks that want to come up. You're maybe still going to have those breaks. But if you can smooth that out a little bit with airflow, that can often be helpful for decreasing the effort, or at least having you get through that sentence with a little more ease. So those are some techniques specific to AB and AD. If you have tremor, that airflow is certainly going to help you as well. The more that you fight against the tremor, same thing with AB or ADSD, the more that you fight through those symptoms or fight against those symptoms, the symptoms are likely going to be exacerbated. So if I'm using more effort to get through the tremor or breaks, I'm going to feel that more in my throat, but it's also going to exacerbate my symptoms likely. Versus if I'm able to relax these muscles consciously, focus on the breath flow, or forward focus to my voice, it becomes a little bit easier. And the symptoms are less exacerbated or less apparent. Same thing with MTD. So MTD, the whole purpose, so voice therapy can cure MTD, but MTD often is secondary to something else. So even if you cure the overlying MTD, if it's secondary to something like spasmodic dysphonia, you're still going to have the underlying spasmodic dysphonia symptoms. But again, the goal is to teach you different ways of compensating and more efficient ways of using your voice. So those can be helpful strategies. I wanted to touch upon something called sensory tricks. So you may have heard of these before. So sensory tricks are something specific to spasmodic dysphonia that when you're speaking in that manner of vocalization, it makes your symptoms maybe disappear or maybe be less apparent. So some examples of this are singing, speaking in a higher pitch, speaking in kind of a whisper voice quality, emotional speech. Some of you might notice that symptoms get a little bit better when you're speaking in this way. And that's because it's using a different manner of vocalization that typical speech is using. So you might notice temporary relief when you're in these different patterns. I would not necessarily recommend to speak in those patterns, and I'll tell you why in a second. But we can use different aspects of different aspects of each of those techniques to capitalize on what's helpful in each of those and maybe bring that into a more natural speech pattern for you that's helpful. So, I've heard many of you say that speaking in a higher pitch certainly helps. If I'm speaking way up here pretty frequently and I'm trying to always raise my voice way up here, number one, that feels pretty uncomfortable in my throat. I feel that push in my throat and that strain and that squeeze, because that's not where my normal pitch range is. But also it just feels really unnatural to me, and it's something that I'm likely not going to use in normal conversational settings because it just doesn't feel good. It doesn't feel normal or natural to me. So instead, maybe capitalize on maybe slightly raising your pitch if you're really low or hanging out down in your throat, but maybe use some more intonation to reach some of those higher pitches, but without consistently straining to keep it up at this really, really high pitch that's going to eventually exhaust my throat and lead to some vocal fatigue. If whispering is beneficial to you, I've heard, some people say that whispering is really the only way that they can get a voice out or smooth voice. Whispering can also be equally as straining. So if you're getting somebody to hear you, but only just whispering, I'm really pushing for my throat to try to get you to hear me when I'm whispering. And so I'm causing actually a lot of tension and strain when I'm doing that. So if you can capitalize on maybe using some flow phonation or just that easier voice with maybe some forward focus, that can help the voice be a little bit smoother or easier for you without necessarily needing to go in your throat for that strained whisper all the time. If, singing helps you, you can use singing as kind of a vocal warm-up if it's feeling good and it's not causing you any strain. If, singing helps, you can also use this kind of like sing-songy type voice in conversation. So you can exaggerate your intonation when you're talking, and then bring it back towards a more natural form of speech for you. So using that kind of intonation pattern is a great way to capitalize on the fact that singing might be beneficial, or maybe speaking in a higher pitch might be beneficial. What if we try to use more of that flowed intonation when you're speaking, and that can help you get out of your throat? So that could be the difference between me kind of like speaking in one pitch here, where it's really hard for me to get out of my throat there. Or what if I try to kind of release those sounds a little more and get a little bit of a different pattern of intonation. I'm trying to bounce my sounds a little bit. I'm using more airflow when I'm doing that. And I'm able to get my voice more up here, but more released and less in my throat. So those are some techniques that you can kind of play around with and see how they can be helpful. I will go through some vocal hygiene really quickly, and then, I'll take any questions if anybody has any questions. So vocal hygiene, I'll just go through some here. You can find more details on the handout too. I won't go through all of them, but you want to make sure that your larynx in general is remaining healthy and that you're taking good care of it, just like you would the rest of your body. So, make sure, first of all, you're well hydrated. If you're dehydrated or your tissues are dehydrated, it could lead to increased roughness or more strain and effort when you're trying to produce voice. So see if you can maintain about 60 to 80 ounces of drinking water per day is a good estimate, but make sure you're staying well hydrated. If you are drinking a lot of dehydrating substances like lots of caffeine or alcohol, make sure to balance it out with more water on the other side, or try to decrease the intake of those caffeinated or dehydrating beverages or substances. You want your voice to really stay well functioning, vibrate in a really efficient way. So we might as well do what we can to help at least indirectly there. Try not to push your voice a lot. Now, many of you might have to get your voice out with some extra strain. Try to use these strategies I talked about today and the ones I mentioned in the last webinar too, to get an easier voice without working harder to get that. If your voice feels tired, rest it. Just like anything else, don't push past that. You're just going to lead to more vocal fatigue or more tension or tightness in your throat. So rest it when it's tired, or try to reset it again with some of these techniques that we've been talking about. You want to really avoid inhalation of any environmental irritants, so smoke, dust, any allergens. Try to control for those as much as possible. You would really generally want to avoid smoking or vaping of any kind. That can be really damaging and irritating to your larynx, so make sure to stay away from those if you can. In general, you want to avoid, projecting or shouting over noise. There's healthy ways to project, and you can work with a speech language pathologist or voice therapist to help you develop those ways to project in a more noisy environment without all that squeeze and strain. But if you're feeling like you're in noise or you're trying to speak over other people, try to rest your voice, or really not try to yell or shout or project in an unhealthy way that's using a lot of these muscles. So those are just some brief general techniques. You can go to the handout to see some more techniques. Again, vocal hygiene is not going to take away any of your voice symptoms. It might make certain things a little bit better, or it might take away some things that are exacerbating some of your symptoms. Caffeine can certainly make any neurological disorder or neurological symptoms worse. So maybe play around with decreasing some of that, increasing your hydration, decreasing throat clearing, or putting extra effort into your larynx, and see how those might maybe have a small effect in terms of leading to maybe less effort or a more consistent or easier voice quality for you